for being on the show today.
Thank you for having me. I'm so grateful.
Well, I'm so glad to have you here, and most importantly, to talk about a very important issue, and that's minority health. And I do want to clarify, she is the director of Minority Health Services for the Indiana State Department of Health, not Marion County. So,
I love Marion County.
We all love Marion County because this is where we're from, it's where we live. So, anyways, last month was Minority Health Awareness Month, correct? And so I'm sure you had a lot of insightful information to give people that came out, whether it be, you know, on a flyer, website, at your place of business. Talk a little bit about that.
Well, Minority Health Month originally started back with Negro Health Week, Booker T. Washington in 1915.
Oh, wow.
And so it took place in April. And from that, they were trying to draw attention to what was going on with minorities, especially the underserved population. Right. And so they made it into law, into where we have it as a national month of celebration. And so the National Office of Minority Health celebrates it. And so there are 47 state offices of minority health throughout the United States and the U.S. territories.
That's amazing.
And so we have an opportunity to be able to highlight what's going on in different populations and support those community people who serve day in, day out tirelessly, trying to make sure that they're creating health equitable opportunities for the people they serve. And so everything from making sure they know about infant mortality, obesity, things that may be specifically addressing one particular community, diabetes, suicide, alcohol, whatever the situation. It's a whole month that allows us to be able to do that. So we celebrate it here. And all throughout the state, we have a calendar that we produce every year that tries to highlight what's going on throughout the state. So wherever you're at, you can help support those events.
Wow. Well, I'm going to be honest, I did not even know that Minority Health Awareness Month was even a thing here. So this is very, very new news to me. And it's also very exciting because I have to be honest, when I first heard about it, I just imagine like people, you know how they have the mobile like blood clinics and just go and just like, it's kind of like nerve wracking. You really don't want to like go, you kind of like walk past really fast. But this sounds really fun, the things you just said.
I want you to go to those health fairs too, because people need to know their numbers.
Yeah, I know my numbers. I have to do it, you know, I have to know. But, you know, still it's not something I want to freely do.
But then it allows us an opportunity to find out about other people in different cultures. So
absolutely.
There's powwows and different things, and things that you would normally like, you can go to, have access, it's free, or maybe it's like a little fee or different thing that just supports that organization.
Right, absolutely. So how long have you been the director of this type of program?
I've been the director for the Office of Minority Health since 2008.
2008.
So it's been a long time.
But it seems like yesterday when you think about it.
Yeah.
No?
No. But it's been a rewarding opportunity. It's an opportunity to be able to address these concerns that happen to my population, to other populations, to raise awareness to different departments and people, let them know what's going on specifically amongst these different populations, and then also to involve them in the process of making sure that we make those changes that we need in those communities. Not making them an afterthought, but making them part of the solution. Absolutely.
Everybody can get involved. And let's talk about that. Like, I'm sure, do you guys take volunteers, people that come and help, like, set up or help? You know,
so it just depends. We do things throughout the whole entire year.
Okay.
I know the next thing that we have coming that's really big is the In Shape Indiana Black Minority Health Fair.
Oh,
it takes place during Expo. We see 20,000 people over a 4-day span. And so, yes, we need volunteers. We need them desperately. Yes, please email, call, whatever. We need volunteers. But it's an opportunity to be able to serve the community. We offer over $1,500 worth of free health screenings. Oh, wow. And I want people to not just look at it as, oh, this is an old people thing going. Everybody needs to know their numbers and different things because health happens from the youngest to the oldest. So we all want to be better.
Right. And you brought up a good point. I mean, everybody does need to know their numbers. And I know a lot of times in the minority communities, you know, going to the doctor for your normal checkups is kind of like unheard of, but and it's an extremely important thing that, you know, everyone needs to do. And something like what you're doing with the minority health awareness and then the thing you have going on during Black Expo is like a prime time because you'll already be out there in the streets during Black Expo, so you might as well stop by and see Antoinette because you'll be there as well.
24 hours, I guarantee it. Probably be sleeping there, so you'll see.
Right. So aside from the fairs and everything that you're throwing, what is a typical day like for you as the director of Minority Health Services?
It just depends upon what project or thing is going on. We try to support our partners in the community. We meet monthly with Minority Health Partners because my office is 3 people and a possible. if you play the
Three
game
and a
of
possible
spades.
like spades.
So there's no way that 4 people can address all of Indiana's issues and concerns, but with the partnerships and things and collaborations we have, we're able to support one another. So then whatever particular month or time it is, we try to make sure we address those issues and concerns. The state priorities right now is infant mortality, obesity, and smoking, so those remain our top 3. I mean, we know that violence is happening within our communities, and we want to save our young people, but we want our young people to reach past the age of 1. So,
so can we circle back to the infant mortality? Let's talk a little bit more about that. So can you go in more detail, or is it just like sudden infant death syndrome, or just something with the parent not taking, like the mother maybe not having adequate?
There's a lot of different factors that contribute to infant mortality. And the things that we try to focus on, we promote safe sleep. We promote you carrying the baby to full term as much as possible. You know, sometimes we know certain situations prevent you from doing that. But if you can't carry your baby 40 weeks, no smoking, getting prenatal care, even if this isn't your first baby, making sure that you take advantage of those opportunities. And then the support system too. You may not be the pregnant one, but know someone that's pregnant. You can promote and help them get the best awareness of things too. So letting people know about infant mortality, how it affects African Americans 2 times more than an average white person, and different things. And so our babies are not seeing their first birthday. So we want to make sure we get that word out. We want to make sure people are part of the solution in solving that. So from the mother to father to the grandmama, Miss Joe down the street that don't got no children, but everybody call her mama. We need everybody involved.
To come together. Wow, that is very startling to hear that you know, that about the infant mortality rate. So can anybody just call you just with a gripe, or just hey, I don't want to go to the doctor? Like, how does that work? You know, because you're here on the show and you might have somebody out there that may not want to go to a clinic or whatever, but they feel like, oh, she's a nice lady, can I look her up and call her?
You can call the office.
Okay.
If you don't necessarily get me, I promise you'll get somebody. But we'll connect you with resources that you need. So if you're in Marion County, you know, there's local things like the Marion County Minority Health Coalition that can help you, the Indiana Minority Health Coalition, statewide partners and things that we can connect you to, because the state doesn't necessarily provide direct services, but we can help you in regards to be that connector. And then also we can make sure that we get you to the right people, because sometimes you just don't know what to do. How do I go about doing this? Where do I start? I want to do something in my community. Then we can just kind of help direct you to that point.
Right. So what would you say, like, now's your chance to people out there that are watching that maybe have not been, you know, getting checked out or knowing their numbers and so to speak. What would you say to them?
Know your numbers. I think it's very important, because I think sometimes the younger you are, you feel like you're invincible against the world and everything, but you'd be surprised how many of our young people are finding out that they have cancer, how many of our young people find out they have hypertension, different things. And so know your numbers, even if you are young. So take time. If you go to that drugstore or the Walmart and you waiting around for something, go ahead, take your blood pressure and see, especially if it's hereditary. Sometimes we ignore it until it hits home as far as what's going on. If you know you have these things in your family, like prostate cancer, different things, get checked out. Don't be scared to ask the doctor questions. Don't be scared to get your point across, because you're your own best health advocate. I don't know if you had a headache today or not, but you do. You know if something's wrong in your body and it's off. So you have to be your own health advocate. So you have to champion for yourself. And then if you're a person that's like, I don't know what to ask, find somebody that will champion for you. And then that way you'll be more successful.
I like the champion word. That's a nice way
champion for you. We want you to be empowered, and we want you to walk away with a better health. That ultimately, that's what it is. And it's small steps, from everything from parking your car, taking steps. I'm doing them, and I look like it, but I promise you I'm doing it. So parking your car, taking steps, going to the trainer at 7 in the morning, even though he kicks your tail. You know, those things that you got to do in order to make changes. That's what you got to do.
Right. So a couple more things I want to definitely hit on before we wrap up. So you did mention that there is a health fair during Indiana Black Expo. Can you give the dates and times? And that?
July the 14th through the 17th will be the health fair.
Okay.
Thursday is when we open up. We offer free transportation on Thursday to seniors and people with disabilities. And so that information will be coming. We make sure you'll get that.
Right.
Where you can register for a free ride. And then again, that Thursday is free admittance, but if you do come to Expo Friday through that Saturday, you have to pay the fee. Sunday is going to be free, to my understanding. And then you have an opportunity to get your hearing, dental, your feet screened, hypertension, A1C, full lipid panel, which means they do all the cholesterol numbers, prostate screening, so men, they'll do the blood work. They won't do the other thing. But they'll do the blood work.
So they can test your blood for
They
like
can test
prostate.
your blood. And you have to have the other test to make it conclusive, because I want people to understand that.
So it's a 2-part test.
Right, but they'll just do the blood work. And so if you have an abnormal number, they'll at least prompt you to go to get the other test.
Check out.
Yes, because when I tell people prostate, they're like, no, you ain't turning me over or anything like that. So
you gotta do it, guys. It's a part of life. There's things that women have to do as well that we don't want to do. So,
right, so there'll be breast self-exams. So we have some of the best breast cancer doctors that's tied with Community Health Network and different things. They'll come, they'll answer questions, different things like that. There will be a healthy entertainment stage, because we want you to be knowledgeable, we want you to be empowered.
Right.
There's a healthy activities area, so if you want to know what to do, from everything from chair exercises to Zumba to stepping, whatever you can find that's going to be your kind of guide to making you live a healthier life, that's what we'll do. We'll have lead testing for children. We have a whole gamut of things that's going to be in the health fair. Hearing screening, different things. Even if you're a mother and you're breastfeeding, we have education about breastfeeding. We have a grant that we received from Healthy Human Services called Empowered. We try to do interactive opportunities where people can come get incentives for learning and walk away empowered.
Wow. Well, I've already made it up in my mind that you have to come back before. Oh, I'm going to come. Okay. I'm going to try to, make an appearance. Maybe I can interview some people or something.
Please, I'll let you come on.
But I do want you to come back shortly before that, so we could just remind people that it's going on. And then lastly, I want you to let people know where to contact you, where to find you, whether it be a website or something like that.
You can go to the Indiana State Department of Health website and look under the Office of Minority Health, or you can call our number, which is 317-233-7499. Or you can email us at inomh@isch.in.gov. I had to remember that. inomh@isch.in.gov. I know it's a lot, but you can contact us anyway. And if Tahlia doesn't mind, if she don't remember anything, that she'll find a way to get to me.
I will. Yep. Just email me or go on the site. So thank you so much.
Thank you for having me. I greatly appreciate it.
No problem. I wish you the best of luck with planning this, because I know it's going to be a lot that goes into it. So, but if there's any way that I can help, even if it's putting a flyer up on my site or something like that, definitely let me know.
Well, I appreciate your support. Thank you very much.
All right, no problem. All right, guys, we're going to take a quick break. When we come back, we will be sitting with Mr. Black on Black himself, Gregory Merriweather. It's the Tahlia Speak Show.